Hello and welcome back to Vidyarthee Education. In today's video, we are going to learn about a holistic treatment of cancer, that is the CAR T-cell therapy. Make sure you have subscribed to our channel and press that bell icon. So let's get started. Why is it in news? There are three major forms of treatment for any cancer, that is surgery, removing the cancer, radiotherapy, delivering ionizing radiation to the tumor, systemic therapy, administering medicines that act on the tumor. Now, surgery and radiotherapy have been refined significantly compared to the systemic therapy. Now, how has the systemic therapy evolved? Systemic therapy's earliest form was chemotherapy. When administered, it preferentially acts on cancer cells because of the latter's rapid unregulated growth. Chemotherapeutic drugs have modest response rates and significant side effects as they affect numerous cell types in the body. The next stage in its evolution was the targeted agents, also known as immunotherapy. The drug binds to specific targets on the cancer or on the immune cells that help the tumor grow or spread. This has fewer side effects. What are CAR T cells? The chimeric antigen receptor T cell therapies represent a quantum leap in the sophistication of cancer treatment. So, the CAR T cell therapies use a patient's own cells. They are modified in the laboratory to activate T cells, a component of immune cells, to attack tumors. Now, these modified cells are again infused back into the patient's bloodstream after conditioning them, which helps them to multiply more effectively. The cells are even more specific than the targeted agents and directly activate the patient's immune system against the cancer. It is also known as the living drug. Now, how does it work? In CAR T cell therapy, the patient's blood is drawn to harvest T cells, which are immune cells that play a major role in destroying the tumor cells. These cells are modified in the laboratory so that they express specific proteins on their surface, known as the chimeric antigen receptors. This modification allows CAR T cells to effectively bind to the tumor and destroy it. The final step in the tumor's destruction involves its clearance by the patient's immune system. Now, where is it used? As of today, CAR T cell therapy has been approved for leukemias, that is cancers arising from the cells that produce white blood cells, and lymphomas arising from the lymphatic system. These cancers occur through the unregulated reproduction of single clone of cells. Also used among patients with cancer that have returned after an initial successful treatment or which have not responded to the previous combination of chemotherapy and immunotherapy. Its response rate in certain kinds of leukemias and lymphomas, the efficacy is as high as 90%, whereas in other types of cancer, it is significantly lower. The potential side effects are also significant, associated with cytokine release syndrome and neurological symptoms such as severe confusion, seizures, and speech impairment. Now, how widespread is its use? Major barrier has been the complexity of preparing the CAR T cells. Now, the first indigenously developed therapy in India was successfully performed in 2022. The trials are underway in India. The preliminary results have been encouraging. Now, will it be expensive? In India, introducing any therapy faces the twin challenges of cost and value. Even if it becomes cheaper, the CAR T cell therapy will be unaffordable to most Indians. Now, investments in developing these technologies in India represent the hope that we will be able to provide economies of scale. The sheer volume of patients in India has the potential to drive the cost of the treatment down. So this was all about the CAR T cell therapy. Do not forget to join us on all our social media sites. We'll meet you in the next video. Till then, keep learning and stay curious.